said, published the first paper on this, on the Wuhan virus, on January 24th. Then, 1 week later, you published another paper that suggested, if I'm not mistaken, that it was moving out of China and therefore was likely to be transmissible around, and the paper called for real proper planning. It clearly didn't happen in enough countries. And we know that Dr. Ian Lipkin, who's the US virologist at Columbia University, he has said both the UK and the US was slow, and it's about being slow and not having the adequate or sufficient capacity for testing and tracing. Do they yet have that? I mean, I was stunned to hear, also stunned to hear you say at this late date, we have to use May to get that up. I mean, what's going on?
Well, this is one of the tragedies of the way the United Kingdom has responded, and I'm afraid to say also the United States. We actually published 5 papers in the last week of January which set out very clearly what this epidemic was going to be about. A brand new virus with no treatment, with rising deaths, large numbers of people having to be admitted to intensive care, requiring ventilation, risk of a global pandemic, the need for testing and contact tracing and isolation, the need for personal protective equipment. And it was a real call. Each one of these papers we published was a call to countries around the world to get prepared. We wasted the entire month of February and early March, 4 or 5 weeks, when we should have been getting the personal protective equipment ready, when we should have been ramping up testing capacity. We did none of that. We pursued a policy of herd immunity. Well, that's a policy that might work for a relatively mild viral infection. For example, a relatively benign influenza virus. It is absolutely the wrong policy, and we made the wrong choice. The reason why I'm upset, indeed angry about our response, is that all of those signals were there in the last week of January. And remember, please remember, the Director General of the World Health Organization called a public health emergency of international concern on January the 30th. On January the 30th, it was WHO sending a signal to every single country in the world to say, get ready. And we ignored it. And so did the United States. And that is unforgivable. Well, I think we need to get through the current phase. We need to beat this first wave of the pandemic down. And then we need to pause, and we need to reflect and learn the lessons. And I do believe that a public inquiry is needed so that we can understand those lessons. That was why China responded the way China did in Wuhan. They went through the SARS outbreak in 2002 and 2003. And as soon as they got the first signal in Beijing, they knew in Beijing that this was a potentially new SARS virus. They immediately informed the World Health Organization on December the 31st because they recognized the threat. So my view, actually, is that we should be grateful to the authorities in China, additionally grateful to the World Health Organization, because they did all they could to alert the world as to the seriousness of this pandemic. Unfortunately, it was many Western democracies that didn't take those signals seriously enough. That is not the narrative that we're hearing played out at the moment, but I do believe that it's closer to the truth than what we're hearing currently.